Good day everyone, my name is Ranjan Sairi Argota from BSN 11E, and today I'm going to perform the parenteral medication into the Cori case. Check the patient's medical records if it is available. The second step that I'm going to do is that I'm going to determine which assessment that I'm going to do and prepare all the equipments that are needed. So the equipments that are needed for this assessment is the syringe, which is the syringe is the 3cc, which I'm going to use for my patient. The cotton, the alcohol, and of course the medication that I'm going to use for my patient. The next thing that I'm going to do is I'm going to perform the hand washing procedure. The rationale for that is to prevent the cross-contamination and to prevent spreading a lot of microorganisms. Introductory case. Greet your client politely, introduce yourself, and verify client identity. Hi ma'am, my name is Ranjan Sairi Argota, and I am your student nurse for today. You can call me Ray. Ma'am, can I ask for your name?
Aida ito,
How old are you, ma'am?
57.
Alright. Do you have any medical records?
No?
Thank you, ma'am. Rationale. The rationale for this is to build rapport with your patient. The next thing that I'm going to do is I'm going to ask my client his or her comfortability, privacy, and confidentiality. Ma'am, can I ask for your, can you describe the temperature of our room? It is hot or not? So we could adjust it.
No, it's okay.
It's okay. Ma'am, are you fine with closing the door?
Yes?
The window?
Yes?
Okay, ma'am. Thank you for answering my questions, ma'am. The rationale for this is to determine if your client is comfortable with his or her position and with the setting that you're going to do the assessment. Prior in performing the procedure, prepare all the equipments that are needed for the assessment, which are the syringe and the medication that you are going to inject with your patient. The rationale for that is to do the organization regarding with the medications. And the next thing that I'm going to do is I'm going to check for the discoloration or any abnormal findings before injecting the patient, which is the intradermal assessment. Hi ma'am, I'm here again. I'm going to do with you is the intradermal injection. So before I'm going to do the assessment, I will check your intradermal in here part. So I'm going to check for any discoloration. So I would prefer this if it is okay to do the assessment. Okay, since my patient, I didn't notice any discoloration with the skin of my patient, so my patient is now ready for the intradermal injection. And since that we are in the quarantine right now, so I could not really inject a real patient, so I find we are required to perform the parenteral medication with the eggplant or a chicken breast. So I chose the eggplant in where I could perform the parenteral medication. So the second step that I'm going to do is I'm going to pick up a syringe and attach the aspirating needle to syringe. So the rationale for that, I also place the syringe on hypodermic tray, so which is this. So rationale for this is pharmaceutical products for parenteral administration are supplied in various containers. So next thing that I'm going to do is follow the correct procedure of removing a drug from an ampule or vial. So since that we are in quarantine right now, I couldn't make to buy an ampule, so I will just use a water for example as a medication. So and the rationale for this is aspirating needle could be accidentally inserted pass through beyond the skin when the intradermal injection is being performed. Insert the needle into the center of the rubber cup and inject the air, keeping the bevel of needle above the surface. So position the injection like this. The air will allow the medication to be drawn out easily because fluids move from area or greater pressure than area. So now I already get the water as the for example as the medication, and I already inserted the needle into in where the medication could be in the in the syringe. So after doing it, tap the syringe to remove the bubbles that are existing in the syringe, and also the rationale for this is that tapping the motion will cause air or air bubbles to rise at the top of the syringe in this part, and where you can where they can be ejected. So now I am done preparing the syringe and the medications, and now I'm going to perform the intradermal injection. So before performing the assessment, I will get the cotton that has been soaked with the alcohol and do it centered to outside. Now I'm going to get the needle and remove the cap of it by pulling it straight off, and I'm going to enter the needle flatly so that the point of the needle can be seen through the skin, and slowly release the medication. So stabilize the syringe and needle and inject the amount of the solution that has been done already. So the rationale of that, if a small wheel appears, all the solution are in intradermal tissue. So next is I'm going to remove the needle. So I'm going to withdraw the needle at the same angle that has been inserted, and I'm going to the rationale for that is minimize the tissue damage and discomfort of the patient. So the next thing that I'm going to do is encircle the wheel of our blue or black pen and instruct the patient or the watcher to do not rub the wheel or erase the marks. So rationale for that is massaging the area may interfere with test results and by spreading meds to subcutaneous tissue. After doing the assessment, assist your patient to a comfortable position. Ma'am, can you please do your comfortable position? It's up to you if you're going to do the supine position or you're going to sit down.
No, I will
Sit down. Okay. Ma'am, thank you for the participation regarding with the intradermal injection. Thank you for today, and I hope you have a good day. After doing the assessment, please make sure that you didn't reuse the syringe that you have used to your patient. The next step that I'm going to do is I'm going to perform the subcutaneous injection. So, as what the PR needs to follow, repeat the step 1 to 4, which is check the medical records of your client, introduce yourself and verify client's identity, allow the client to ask questions. The next is perform the hand washing procedure, and lastly, arrange the equipments or prepare all the equipments that are needed for the assessment. Discuss to the patient each medications that you are going to give. Discuss to the patient also what are the positive effects of the medication. Allow the patient to ask any questions and to clarify about the medication. Hi ma'am, the assessment that I'm going to do today with you is I'm going to do the subcutaneous injection. Do you have any clarifications or questions regarding with the medications that I am going to give to you today?
No.
Okay, thank you, ma'am. Also, ma'am, I would like to say that the positive effects of the medication is that it will give you more strength, because the medications that I'm going to do to give you today is about for the stronger bones for you. And also, ma'am, I would like to say that the medications that I'm going to inject with you today is safe, and we make sure that the medications are really safe for our patients.
Okay.
Okay, ma'am, thank you. The rationale for that is discussing each medication to the patient is for that your patient would be knowledgeable about the medications that you're going to give to his or her, and also allowing your patients to ask questions about the medications that you're going to give is for him or her to be more knowledgeable and to ensure the patient's security that he or she is safe regarding with the medications that you're going to give. The next step that I'm going to do is I'm going to decide which part of the patient will I'm going to inject. So as mentioned earlier, the side that I'm going to do is subcutaneous injection. So I will expose the area in where I could perform the assessment. So this is the subcutaneous area, ma'am. And now I'm going to check if there are any inflammation or tenderness regarding with the skin or with the subcutaneous part of my patient. So now I'm going to check if there are any discoloration or inflammation regarding with your skin before doing the assessment. Okay. Rationale. Checking before doing the assessment is very important to ensure that your patient is safe before doing the assessment. Palpate the site in where you're going to inject your patient, which is here, the subcutaneous. Check for any tenderness. And since I didn't feel any tenderness with the subcutaneous part of my patient, so the rationale for that is to make sure that the part in where you're going to inject your patient is now ready for the subcutaneous injection. Place your patient in a comfortable position. So, ma'am, I would like to ask if you're willing to sit down so we can perform the assessment.
I will sit down.
Okay, can you please sit down, ma'am? So, positioning your patient in a comfortable position will allow your patient to be comfortable with the position and be relaxed during doing the assessment. So, now I'm going to locate the site of the injection. So, since that we are in a pandemic now, so I found another way so I could perform the subcutaneous injection, which is I'm going to use the eggplant as my patient for the subcutaneous injection. Locate the site of injection, so I'm going to use the eggplant and I'm going to site where the skin appears healthy and free from irritation, inflammation, and reduce the discomfort of injection. So I'm going to cleanse the area to be injected by using a firm stroke of circular motion from inner to outer. So I'm going to get a cotton that has been soaked with the alcohol, and the rationale for this is friction aids in cleansing the skin. Clean area is contaminated with soiled object and rub over its surface. So I'm going to cleanse the area with circular motion from inner to outer. So it would be like this. Okay. And throw the cotton properly. Next step that I'm going to do is I'm going to grasp the area surrounding the site of injection and hold the cushion fashion using a non-dominant hand. So this is I'm going to use to hold like this. And the rationale for this is pushing and subcutaneous tissue helps to ensure having the needle enter into aerial connective tissue. So now I am now holding the here, and I will now pull the cup of the syringe to avoid contaminating the needle, and grab the syringe with my dominant hand and fingers. Inject the needle quickly at angle of 45 degrees. Make sure that the angle of it is flat, so you could just inject the medication easily. Release the medication and put a cotton. So the rationale is pain is minimized by inserting the needle without hesitation, and subcutaneous tissue is abundant in well-nourished, hydrated person and scarce in emaciated, dehydrated ones. So after that, cover the injected area with a cotton. After, care the equipment, needles, and sharp and designated containers. So put it in a proper trash so no one could be hurt by it. So the rationale for this is to protect the nurse and others from injury and contamination. After doing the subcutaneous injection, we are going to record the time and the amount of the medication that has been given to the patient. So the rationale for this is to prevent medications error. After doing the subcutaneous injection, we will proceed to the trimuscular injection. So repeat the step 1 to 4, which is determine the or check the patient's record if it is available. Next is greet your client politely and introduce yourself and verify client's identification. The next thing that you're going to do is perform the hand washing procedure to prevent spread of all microorganisms. The fourth thing to do is to explain to the patient which assessment that you're going to do. So the next thing that I'm going to do is I'm going to ask my patient to position in a comfortable position. So ma'am, the assessment that I'm going to do with you today is I'm going to do the trimuscular injection. So I would like you to please position yourself in a comfortable position, which is the supine position, so I could perform the assessment properly. So you can now So the rationale for that is to ensure the comfortability with the of the patient. In performing the trimuscular injection, you're going to site or select a appropriate site in where you could do the injection. There are two sites, which is the vastus lateralis and the deltoid muscle, and where you could perform the IM. So examine the area in where you could perform the assessment, and this is the area in where I could inject the patient. So I'm going to expose only the area in where I could perform the IM injection, and I'm going to palpate the muscle if there are any tenderness or inflammation in this. So since that that area is free from any tenderness and inflammation, so the patient's area in where I could perform the IM injection is not ready for the assessment. So after doing that, I'm going to inspect for any bruises or any inflammation in that part. So I'm going to expose again the part in where I could perform the IM injection and check for any bruises and inflammation. So the rationale for this is checking for any bruises or inflammation is for you to know if the patient if the patient's area in where you could perform the IM injection is it is okay and there are no any abnormalities regarding with it. So now I'm going to ask my patient on where he or she could be comfortable so I could do the assessment. So ma'am, are you comfortable with the supine position or are you comfortable with the sitting position?
Only
A supine position. Okay, so asking your patient or helping your patient doing a comfortable position is so that your patient would be relaxed and be more comfortable to participate with the since that we are in a pandemic right now, I am not allowed to inject a real person. So now I'm going to use an eggplant as my patient in where I could do the intramuscular injection. So first, I'm going to a site in where I could inject the intramuscular area, and I'm going to gently select the area with using my fingers to check if it is tender or if there are any inflammation regarding the area of it. So the rationale for that is stimulation of the peripheral can minimize the injection and also the needle that has been inserted to the patient. Now I already cited the area in where I could inject it. So I will get a cotton that has been soaked in the alcohol and clear the area thoroughly using cotton ball with alcohol from proposed size of injection. So the rationale for this is to prevent entry of microorganisms into the tissue. So hold the site in a cushion fashion manner and hold do it as inner to outer. So like this. Okay. So the rationale next is I'm going to dispose the cotton balls that has been used and hold the syringe in the dart position with the 90 degrees angle. So the rationale for that is to ensure insertion of needle into the muscle. Inject the needle in the correct depth angle once the needle is in position. So I'm going to position the needle in the patient and release the cushion tissue to hold the hub needle. So I'm going to position it. So the rationale is to establish the needle. So aspirate the plunger determine whenever the needle is in the correct side. So I'm going to inject it slowly. And make sure that it is in a flat position. So after that is I'm going to so the rationale for this is to determine if you have hit a blood vessel. If a blood is present, you draw the needle and restart with a new needle. So go. So now release the medication and get the cotton and place the syringe in the its proper place. So do not recap the used needle, discard needle and the syringe in receptacle. Wash your hands and document the nurse's notes and request for resident to interpret the results for 30 minutes. rationale to prevent prick injury, and rationale for documenting is documentation prevents medication errors. After performing the assessment, ask your client to do the position which he or she could be more comfortable. So ma'am, I am now done doing the assessment, and now you can now sit down and prepare yourself because I am done with the assessment.
Only like this.
Okay. Closing please. Summarize all the documentations that you have done during the assessment, and thank your client for participating for the assessment. So ma'am, I am now done doing the assessment regarding with the intramuscular injection or IM, the subcutaneous injection, and also the intradermal injection. So ma'am, we will just inform you for the results regarding with the injections and for your medical records. And I thank you for participating for the assessment today, and I hope that you have a great day. Thank you, ma'am. Again, my name is Ranjan Saidi Argota, your student nurse for today. Thank you for participating, ma'am.
Okay.
So now, I am done doing the parenteral medication. And again, my name is Ranjan Saidi Argota from BSN 11E. And have a good day.